welcome to Talk Trillium, Partnering for Patients. I'm Patty Cochran, Senior Vice President and Chief Innovation Officer at Trillium Health Partners, which has 3 locations, 2 in Mississauga, the Mississauga Hospital and the Credit Valley Hospital, and the Queensway Health Centre located in Etobicoke. I'll be your host today as we take a closer look at how our hospital is working with our community to create a new kind of healthcare for a healthier community. And today it's really my honor to talk a little bit more about the Trillium Health Partners Foundation. But before I introduce our guest today, let's take a quick look, video clip, at why it's so important for our community to support our organization.
Community support for our hospital is key to our work. With our community, we're able to partner with their time and their financial support in being able to develop new innovative ways to support patients and their families. We're able to test new ideas, work with them on better ways to deliver the care that makes it easier for them at their time when they need us most.
It's about building something together, and we would not be able to build this without the wonderful community support we enjoy.
The foundation is dedicated to raising the critical needs the organization needs for our highest priorities. Their mission is to inspire the community to invest in a new kind of healthcare for a healthier community. And it's my great pleasure today to introduce our guests. Michele Darling, she's our board chair of our Trillium Health Partners Foundation. Welcome.
Hi, Patty. Good to be here.
And Steve Hoscheit, our president and CEO of our foundation.
Good morning, Patty. Thanks for having us.
So Steve, tell me why the foundation is such an important part of the organization and why it's so important for our patients.
Well, as you mentioned earlier, Patty, our mission is to inspire the community to support a new kind of healthcare for a healthier community. And we're really in a wonderful place to be the conduit and connector to the community between the hospital. There's so many individuals that have benefited from the care at the Trillium Health Partners that want to give back. They want to participate and support the hospital in so many ways, including wonderful volunteerism, like Michele Darling as our board chair, but also the want and desire to give back. And so whether it's a lemonade stand you'll be hearing about later, or a major gift, or we host over 200 third-party community events in support of the hospital, and a myriad of different activities. To be that connector is such a wonderful role to play, and we're so proud to be ambassadors of the hospital, and we're inspired by the hospital as the community is inspired to support the hospital. But I think the lovely piece around this is how inspired the hospital is by the community support. When they see the hard work and dedication of community volunteers raising funds through third-party events, major investments that people have made out of their own income and their savings. It's just a wonderful way to connect back, give back, and to raise excellence, as Michele mentioned in the earlier part of the video. Allows us to add those special touches and enhance excellence at the Trillium Health Partners.
And I think today's program, it's really exciting to see that donors, both big and small, are so critical and so important to our organization. So it's both. Now, there's a little bit of misconception out there, I believe, around hospitals receiving most of their funding or all their funding from the government. Can you explain how the funds are used from the foundation and why they're so critical for the organization?
Well, there's really 3 areas of focus for us. If you look at the major capital builds around all 3 sites, there's typically been what's called a local share or community participation to the equivalent of about 20% of the capital build. So when you're talking about a $100 million project, $10 million needs to come from the community. So it's an essential support piece, and it's built into the actual build of these capital areas. Government doesn't pay for capital equipment. They pay for the operating funds for it, but it's the community's role in the hospital in partnership with the foundation to raise funds, so they have the working capital to support capital equipment replacement, but also to introduce new and innovative technologies at the hospital. And then finally, I mentioned earlier about the opportunity for us to build programs and to elevate the operations at the hospital. And there's many examples of where we've had a significant impact, and the community has had a significant impact to grow excellence at the Trillium Health Partners.
So to understand this a little bit more, hospitals, we receive funding from the government for operating costs. That means like salaries for our staff to look after patients, but things like capital equipment and big equipment like that, we are reliant on donations coming from our community and the support from our community. That's helpful to understand, I think, and why it's so important for us to work closely with the foundation. Can you expand a little bit? You mentioned some of the programs that you've been able to build through innovation donations and contributions. Can you expand on what some of those programs might be?
Well, there's a number of great examples, and they span all 3 sites of the Trillium Health Partners. If you look at the Carlo Fidani Regional Cancer Center, played a significant role in the fundraising aspect of that. The community rallied to support that, and we have that wonderful facility. And when it starts to translate into enhanced care and the right care in the right place at the right time for our patients, we're now number 2 in the province in terms of cancer centers based on quality indicators. We're number 1 in the province in terms of wait times for chemodialysis. So it's a great example of how the community support has really allowed us to advance the work that we do for the benefit of the community.
Yes.
Another example is the our advanced cardiac care program, the Hazel McCallion Center for Heart Health at the Mississauga Hospital. The support from the community built 4 catheterization labs, and they wouldn't have existed without community support. Right, and it built a program, and now we are, in terms of our STEMI program, or in ST, elevated myocardial infarction, when someone has a heart attack and they're diagnosed by our partners with EMS, and by the time they're in the cath lab, it's under 70 minutes typically. That's the best internationally.
Amazing
in terms of
work.
times.
Amazing
work,
yeah.
And plus the having that right here in your community.
Yes.
Right, and that's the importance, right? It's all about the community. It's in here for our community and serving our community.
So before we hand it over to Michele, let's take a quick video look at one of our major donors, Fred Ketchen. He recently announced something this year, so let's take a quick look at his announcement.
I've talked about Nicola's story. Now I'd like to share another one with you. And he's going to be a key feature in a couple of minutes as we do something really exciting and very special. And his name is Fred Ketchen, who is sitting right over there. You know, you're a caring and humorous and inspirational person. Your example has inspired all of us to do more. And I now like to invite Steve Hoscheit, Foundation President, to join me here, and Fred, because we have something very special to tell you that will inspire you further to make a contribution to this hospital.
Today we're very proud to announce that Fred Ketchen is making a significant investment in our hospital and our community. $5 million to create a new kind of healthcare for a healthier community.
Michele. Fred has now donated about $6.3 million to the Trillium Health Partners. What is it that inspires people to give so generously to our organization, Michele?
Well, I think Steve covered so much of it. We're innovative, we're right in the community, we have wonderful services, we focus on our patients, we care about them deeply, and we make sure they're getting the best possible health care anywhere right here in the West End, so that's wonderful. But I'd like to talk a little bit about Fred. Is that okay with you?
Yes.
I mean, that was probably one of the most exciting moments I've ever had, any time. So Fred Ketchen is not only a great businessman, he was very, very successful, but he has a caring, big heart, and he loves our community. And his history with the hospital goes way back. 50 years ago, he was involved in fundraising, along with Rotary and his dad, for the hospital. For Mississauga Hospital, and when it opened, he was there at the groundbreaking ceremony and helped open the doors, you know, when it finally opened. And then when he was 42, very successful career going, he experienced some chest pain, and he went to the hospital thinking he might have flu, and he met a doctor there who saw him in emergency and said, you know, no, you don't have the flu, you're having a heart attack. And Fred argued with him. He said, no, I'm fine, you know, I want to go home. And this doctor convinced him that, you know, indeed he was having a heart attack and really saved his life. And I think then, you know, Fred said, we need this in our community. I'm a grateful patient, you know, thank goodness for our hospital, and I'm with you now. I'm going to help you. So it's those kinds of stories that when they're told resonate with other people who've had similar experiences of being really saved by great quality health care right here in our community.
So Fred's a great example of someone who's had loyalty to the organization over a long period of time. I think it's fitting perhaps to mention one other donor, Mr. Harold Shipp, who's been a generous donor also to our organization. He's recently passed on. What kind of legacy did Harold Shipp leave for Trillium Health Partners?
Well, you know, Harold also was an incredible business person, you know, built a huge business and decided that he needed to give back. And the best way to give back was to the hospital. So he likewise supported Mississauga Hospital and gave generously, and you know that there is a part of the hospital named after him. And then he continued on, even after that was done, just constantly supporting us with his energy, his enthusiasm. His wife, you know, regrettably passed away within the hospital, but was looked after extremely well, and, you know, Harold was very, very grateful for that. So grateful, patient, wonderful donor, dynamic businessman, and, you know, I will really miss him. He was just a great guy. He really was. A lot of fun, a visionary, so helpful to us.
So we'll be hearing more stories about our donors in later up on the show, but can you tell us why community support is so important for the organization?
Well, you know, I think there are probably 3 levels to it. First of all, as Steve mentioned, we need the funds for equipment and for value-added services within the hospital. It's absolutely essential that we all join together. The second reason for me is that, you know, when you get involved, you create a stronger community. People connect with each other, they come together, and a little later on, you're going to hear some very inspirational stories from young people and older people who have done some things together in this community to make our healthcare better. So bringing a community together and energizing a community, I think, is all part of this hospital experience of being a donor. And the third area is, I don't know about you, but I love having wonderful health care right in this community. And I know so many stories of people having to travel great distances.
Yes.
But my goodness, so important to have it right here. So,
isn't it so important to have it right
seriously.
here? So thank you. After the break, we'll take a look at more donors and the impact on our organization. Hello, and welcome back to Talk Trillium, Partnering for Patients. I'm your host, Patty Cochran, and today our show, we've been talking about the Trillium Health Partners Foundation. Steve Hoscheit was with us earlier today. Welcome back.
Thanks for having me back, Patty.
Steve, you're the president and CEO of the foundation. Wonderful to have you here.
Delighted to be here.
And now joining us, I'd like to introduce Dr. Rose Geist. Dr. Geist is the director of the Medical Psychiatry Alliance, as well as the chief of the mental health program at Trillium Health Partners. So welcome today, Rose. Thank you for joining us today. Earlier in our show, Steve, you were sharing about some of our visionary donors in our community who have really helped shape some leading programs within our community and within our organization. And today, in this segment, I'd like to share with you a new initiative, and to share this is a quick video about the launch of the Medical Psychiatry Alliance.
Today we launched the Medical Psychiatry Alliance. This is a partnership with CAMH, with Sick Kids, with the University of Toronto and Trillium Health Partners, all meant to help deal with some of the issues surrounding those who have both a mental illness and a physical ailment. So today, with the help of a donor, with the Government of Ontario and our partner hospitals, we announced a $60 million initiative called the Medical Psychiatry Alliance.
This is the system working together. This is what we dream of. This is people recognizing needs of patients and figuring out a better way to care for those people. And I'm delighted that the Government of Ontario is here to partner with the generous anonymous philanthropist. We are matching that donation with $20 million over the next 6 years. And the partner hospitals are also raising the money to support this as well.
Great example of partnership. Not only is it funded through a donor, but also working in partnership with 3 other institutions as well as the government, the Ministry of Ontario. For those unfamiliar with what Medical Psychiatry Alliance means or is, I'm wondering if you can help us understand that, Dr. Geist.
Thank you. The Medical Psychiatry Alliance is an innovative way of delivering health care to patients. It's very much focused on the patient, and it's our way of integrating mental health as well as physical health in the way that Deb Matthews so eloquently described, and also Michele Darling. What we're trying to do is be a game changer. We're going to try to change how we deliver health care in 3 major populations. The first population is those people who suffer with medically unexplained symptoms. That's the individual who goes to the doctor or goes to the emergency room with a physical complaint. There's no clear organic cause, but they still suffer with that complaint, and they still struggle in their ability to go to school or to go to work. And we're going to look at that population and create a whole new way of understanding and delivering service to them. The other population that we're looking at is those patients who have both medical and psychiatric or psychological disorders. For example, an individual who suffers with Crohn's disease as well as depression may suffer pain that is poorly understood because the pain is being contributed to by depression. So what we're trying to do is understand how to deliver service, how to understand that population, so those individuals who have both medical and psychiatric disorders will be much better served and better understood. The third population is the group of patients who have psychiatric disorders as well as co-occurring medical disorders. For example, an individual who suffers with schizophrenia and develops cancer. Unfortunately, there's so much stigma attached to mental health disorders that individuals who suffer with those 2 co-occurring conditions may not get the kind of treatment, the kind of early identification, or the kind of management that they require early enough to have a good outcome. So what we're doing, this population really costs the healthcare system a tremendous amount of dollars because, as I mentioned, the population is not well understood, and the management and investigations can be very expensive, including inpatient admissions, frequent visits to the emergency room. And the number that we're looking at is 1.2 million people in Ontario, in Canada, and up to a couple of $1 billion in healthcare costs. So we're doing a very ambitious exercise. We're very confident that we're going to make it happen. And the reason for our confidence is because we have a wonderful partnership. And that partnership is a first, to have an academic environment such as Sick Kids and CAMH to bring the University of Toronto, and to have this huge population of patients here at Trillium all working together so that we can really make a difference. And as Michele says, we really are better together, and that's what our goal is.
Such an inspiring and innovative program, and such a generous donation. Steve, what causes or what is the impact when donors give to us so generously? Well,
I was privileged to be part of the initial request where Rose Geist and myself and other individuals had approached the anonymous donor, and it was very clear that Rose's vision around medical psychiatry really resonated with the donor. It was an individual that was clearly altruistic and a philanthropist and wanted to give back and invest in their community. And they were particularly focused in healthcare. And I think the intersection of mental health and medical, standard medical ailments was of great interest to the individual. And Rose's vision around medical psychiatry really resonated. And then that individual, in their own style, started to take ownership of this and put up forward the opportunity for a major investment, as long as we were able to leverage funds out of the province, as long as we also built a partnership around this, so that it was not just sort of siloed at the Trillium Health Partners. And partners are in our name for a reason, and so now we have built out this where we've achieved significant support, $20 million from the province, another $20 million from the partners within the organization, and now we're looking to the community to match those dollars that have been provided to the Trillium Health Partners through a variety of means and initiatives. So it's just had a wonderful ripple effect across the organization. I think it's a tipping point for us organizationally to be standing shoulder to shoulder with the leading partners in this area in Canada, and the fact that we're at the front lines of healthcare, and the patient volumes and diversity in all its forms provides us with a wonderful opportunity to really enact that model of collaborative care that we're talking about.
So what an amazing story. It starts with one inspiring dream or vision. It connects with a generous donor who has some feelings for that, and it gives so generously, and then a partnership with the organization, and then eventually with the ministry and 3 other institutions. It's an amazing story.
And I'd add to it as well, it's the one individual has also inspired really a groundswell of support within the community as well. We have over 60,000 donors that participate through the foundation in support of the hospital on an annual basis. And now with these matching funds, it's allowed us to connect, whether it's through direct mail or through our special events, with a wide audience, not only raising awareness about medical psychiatry, but also engendering additional support. It's really a fantastic story.
And Rose, what will the Medical Psychiatry Alliance mean for Trillium Health Partners specifically?
Well, Trillium has taken the role in the initiative in developing what we call the collaborative medical psychiatry pillar, which is one of the pillars of the Medical Psychiatry Alliance. So we have an opportunity to create new models of care, to support the emergency room, and most importantly, to support our family physicians who really work very hard with this population but don't have the support that they need. So really what will happen is that as we develop our collaborative med-psych care across a lifespan for kids, for seniors, for adults, our family docs will be much more supported, much more confident in the work that they do with this population, because after all, it is the family physician that most patients go to see with these kinds of difficult, sometimes hard to understand problems. So Trillium will be the lead, probably the national lead. We'll start by being the lead in this partnership, but I'm sure that this will scale up to Ontario and that other healthcare centers will look to us.
Very exciting news, particularly because mental health is such a significant priority for both just locally but also nationally. And just before we go to break, Steve, can you talk a little bit more about robotics? That's another program that the foundation has really enabled to us to move forward in.
Yes, we're establishing a surgical robotics program at the Trillium Health Partners. And it's very similar in terms of the anonymous donor and the impact and ripple effect it's had across the community. At our first Laugh Out Loud, we announced the program and the opportunity to bring a surgical robotics program focused in on oncological surgeries in gynecology and also prostate cancer as well too as the primary focus for the robot. Reduced length of hospital stay, reduced pain and discomfort for the patient, reduced complications and bleeding, and a really beneficial tool for the surgeon as opposed to the laparoscopic surgery, which can be very challenging and ergonomically challenging and technically challenging for the surgeon. This allows a greater latitude in terms of the ability to effectively and strategically and surgically impacting the area of focus. So this is, if we're going to be truly an academic center and at a teaching hospital, this is the type of program we need to engender. And so the surgical robotics piece will bring that in terms of a critical mass of individuals, additional research. The talent base I mentioned earlier is so important for us organizationally. And we were blessed with significant investments from the donor community who backstop this. So they really brought the technology or the program to us. It's going to start up in 2017. We're still actively raising funds for it. But Betty Birmingham, Rob DeBerner, Pierre Morissette, Marie-Josée Overwheel, number of major donors, and literally thousands of other individuals have contributed as well too.
So Robotics program, a great example of a capital investment, and the MedPsych Alliance, another great example of more of a program design, all funded through the foundation. So we couldn't be without you. So thank you very much.
Thank you.
Stay tuned. We're going to hear more from other donors within our community after this break. Welcome back to Talk Trillium, Partnering for Patients. I'm your host, Patty Cochran, and today's show we've been talking about the Trillium Health Partners Foundation. Earlier we said that donations, big and small, are important for our organization, and today I'm pleased to welcome 5 guests that represent some of our small guests in contributing to our organization. So I'd like to welcome Angie Sandow, Nicola Rose, Mercedes Fong, and Gabbie and Garitt Marno. Welcome to our show. So before we start, Angie, we're going to start with you. Let's take a quick look at your video.
I suspected that I discovered cancer in June of last year. I felt a lump in my left breast. I had my biopsy at Trillium Health Partners, and I just remember that day. I remember coming in and I was crying, and I'm not a crier, and I was crying and my husband was there, and I remember going in there and all the people were so wonderful and nice, and it's amazing what someone holding your hand, what that can do for you. Community support.
Angie, we just saw a little bit about your story, but can you tell us what led to your willingness to work towards donations and contributions to the organization?
Sure. I've known a few people over the years that have had treatment at Trillium Health Partners, and my husband was actually there last year. He had a severe case of shingles and had to stay for a week, and it really hit home when I got diagnosed with breast cancer this year. So all my diagnostic, my treatment, everything was at Trillium Health Partner, and I got to see firsthand how important the healthcare is, and the empathy that I've received and the caring from everybody, from the doctors to the techs to the volunteers, everybody. And it really hit home with me, and I just felt that there's something I had to do to give back.
Wow, that makes you really a special individual. So not only are you dealing with your own personal issues, you found a way to make something happen. And that something happen, I think, is called Rocking It Bald.
Rocking It Bald.
Rocking It Bald.
Yeah.
So tell us a little bit about what's Rocking It Bald all about.
Well, I just wanted to start something with some humor. You know, and I came up with this name, Rocking It Bald. I mean, it's not so bald anymore, but at the time it was fairly bald, and I thought, you know, I'd like to use that as a banner for something that I can do. So I'm a musician, and I'm in 2 bands, and what I thought was, you know what, why don't we get some bands together, because people love music, entertainment, keep it positive and keep it upbeat. So got 4 bands together, 2 of which I participated in, and we got a lot of donations from people and companies. I was overwhelmed for silent auction, and we had door prizes, and we had this event on October 25th at PK Creek in Mississauga, and it was just fantastic. We did a reunion of my AC/DC tribute band, Bear Rump, especially for this event. And I was just so touched and overwhelmed by people, because, you know, we live very fast-paced lives, and to see that other side of people and the caring and willingness to help just really touched me.
Event.
It was awesome.
Sounds like
really
it.
Awesome.
So how much were you able to raise?
We raised just under $4,000.
Wow.
Yeah. So I was going for 5. that was my target. So I guess for the first one, I'm fairly pleased with that and very, very thankful.
That's excellent.
Very thankful.
Excellent.
Yeah.
So Nicola, you're a little bit of a poster child, I would say, for Trillium Health Partners. I see your image and your picture in many places. But I'm wondering if you could share with us a little bit about your personal journey and how you've been able to contribute to the organization.
Yeah, sure. So my journey began about 2.5 years ago, oh sorry, a year and a half ago. I started to not feel like myself. I was extremely tired all the time. I would be lightheaded, dizzy, and then I discovered a lump on my neck, and right away I knew something wasn't right, so I contacted my family doctor and made an appointment and saw her, and as soon as I showed her the lump, she left the room and booked me in for appointments that day. And when we got the results back, we found out it was a swollen lymph node that didn't look too good, so she put me on to see a surgeon. I met with him and we decided that it was best to take it out, so I had surgery to remove it. And then the surgeon put me on to Dr. McFadden at Credit Valley Hospital, who is the chief there of the oncology, amazing doctor. And I met with him and we went over our pathology together and he said that, yeah, it is stage 2 Hodgkin's lymphoma, and that I would have to do more tests and start chemotherapy. So that was kind of shocking to hear at 24 that I had to do chemotherapy. But I decided to go about it in a positive way and just make light of the situation. I couldn't change anything, so I just thought I might as well do it the best that I could. And that's what led me to Trillium, and I had my chemo treatments there. It sounds funny, but I loved going there. I got so much support from all the nurses and the staff. They were just amazing. My nurse, Roy, he was just hilarious, made me laugh from the moment I got there till I left. And as sick as I felt, it was nice to have that support from those people. So it was great.
So much like Angie, you're another example of dealing with your own crises, but somehow you found a way towards contributing through the foundation. So can you tell me a little bit about that and what you did?
Yeah, so towards the end of my treatment, I knew that there was something I had to do to give back. I was so blessed to have such amazing people look after me, and I just wanted to give back in some way. So me and my sisters got together and we decided to have a fundraiser and put all the funds towards the hospital, and just a way of thanking them for all the care that they gave for me. And so we ended up having a fundraiser, and I started a fundraising page online. And between those two things, we ended up raising just over $5,000 for the foundation, so that was amazing.
Excellent.
Yeah.
Thank you so much for sharing your
No
story.
problem.
Now we'd like to go to Mercedes. So Mercedes, tell me how old you are, first of all.
I'm 10 years old.
Great. Now I understand that you and your brother Calvin, who's 6 years old, have started something quite innovative. So can you tell me a little bit about what that is?
So we have these bracelets that are sensitive to the UV rays that act as a warning for sun exposure.
So sun exposure is important, right? We have to
Yes.
avoid sun exposure.
Yes, you can have a little bit of sun, but not too much.
So how does the bracelet work then? Can we take a look at, do you have a bracelet with you?
So this is the bracelet.
Okay.
So these two will change color in the sun. These two will glow in the dark, and then these are just regular beads.
Oh, so they're helpful in both the sunlight and in the darkness.
Yes.
And so where do you sell these bracelets?
We sell them at the Trillium Health Partners at Credit Valley Hospital.
Okay. And how much do they cost?
They cost, for an adult is $10 and for a child is $8.
So how much have you been able to raise?
We've been able to raise $412.60 over the summer and September.
Excellent. So what inspired you to do this, Mercedes? What's your personal story?
So my aunt, Dr. Violetta Ladores, is a survivor from cancer, breast cancer. So I wanted to do something more. So I thought of this idea, and I thought I could give back the money to skin cancer research and the hospital.
Now, how did you come up with this idea of this bracelet?
Well, when I did research about sun safety, I researched that there was beads which change color in the sun. So I was like, maybe I could put that in a bracelet. And then the whole thing just clicked, and that was I could make a business out of it.
Wow, so you really are an entrepreneur at 10 years old.
Yes.
Well, that's wonderful. Thank you for sharing your story.
You're welcome.
And now for some really small donors, I'd like to introduce Gabbie and Garitt. Welcome to our show today.
Thank you. Thank you.
So tell us a little bit about what you've done.
So we started our own lemonade stand because we want to give back, because in life, it's what you need to do. You need to give back to the people who support you. So we want to give back to people who supported us.
So you've had some experience then with the hospital, have you?
Yes, well, I was born there, and my sister was born there.
That's great. So tell me a little bit more about the lemonade stand. What's your role?
Well, I forgot again. My sister's role is to just sell lemonade with me, and we just sit there and see if wait for people to come.
And where do you sit? Where can we buy this lemonade?
We can buy this lemonade at my house.
Oh, your house. And where's your house?
On
Queensway?
Queensway, Ontario.
Oh, wonderful.
Mississauga.
So how much does it cost me to buy a glass of your lemonade?
You can choose how much you want.
Oh, so I can give anything?
Yes.
Great. So how much money have you raised?
We have raised every year we did it, which we did it for 3 years now, $14,500.
Wow. That's a lot of lemonade.
Yeah.
And who makes that lemonade?
Well, we buy it at the store and my mom gets it ready.
Oh, she must be an expert lemonade maker.
Yes, she is.
Well, thank you very much for sharing your story. And maybe what I'll do is ask Angie one more question. Angie, tell us, do you have any future plans for Rocking It Bald? Because I love the title of it and it sounds very catchy. And I kind of wish I had attended the October event.
So do I, but there will be more. We're already working on one for next year. We want to do something for Trillium every single year. We were fortunate enough to meet Alice Cooper a couple of weeks ago.
Wow.
And I was talking to him about Rocking It Bald. We have T-shirts, and gave him a T-shirt, and he's really into giving back. I was taken aback when he said, well, do you guys do silent auctions? And I said, absolutely, we do. So he's going to be donating a signed guitar to us that hopefully I'll be getting in the next couple of weeks. And we're already working with different partners to get items in for next year. The signed guitar, he told me, should go at least for $4,000 or $5,000 on its own. So looking forward to that, and working with other bands to try and make it bigger than what we had this year. So absolutely, it's all got to be positive. You know, it's really upbeat and get people out there rocking.
And you're such a shining example for our community, I would say. You're all very positive and upbeat and natural entrepreneurs and innovators. It really is such a privilege for you to pick Trillium Health Partners as the place where you sell your wares and make your contributions. So really, on behalf of our organization and the Trillium Health Partner Foundation, I just really want to wish you all the best, and thank you so much. And you are really great examples of being positive in life. So thank you. Stay tuned as we come back to Talk Trillium and hear more about the Trillium Health Partner Foundation and where we're going. Welcome back to Talk Trillium, Partnering for Patients. I'm your host, Patty Cochran, and today we've been talking about the Trillium Health Partners Foundation. It's my great pleasure to introduce two new guests for this portion of the show. Dr. Eric Letovsky, welcome.
Thank you.
You're Chief of the Emergency Department for the Trillium Health Partners.
Yes.
And Meaghan Stovel McKnight. Meaghan, you have a big title. You're the Senior Vice President and Chief Operating Officer for the Trillium Health Partners Foundation.
Thanks so much.
Welcome. There are over 250,000 visits to our emergency departments across the 3 sites at Trillium Health Partners, making us the largest emergency medicine program in Canada, as I understand it.
Yes.
And now, just to share with our viewers a future glimpse of what the emergency department holds for us at the Credit Valley Hospital site.
Imagine 50 years ago when we built our healthcare system in Mississauga and all of what has gone into that and that investment and the people power associated with that. We have today a first-class healthcare system right here at home. But now we have to take that leadership, we have to take that position of strength, and we have to move into the future because our population is growing faster than almost anywhere in Canada.
We have all experienced a fragile moment where either ourselves or a loved one needs care. And there's many places where you can get care, but there's only one place that you know you can always get care, and that's our emergency department. We have 250,000 emergency visits across our 3 sites, and that's the equivalent of the Toronto General, the Toronto Western, TRI, Princess Margaret, Mount Sinai, and about half of St. Mike's.
When the 20-year-old male is involved in a motor vehicle collision, when the 3-year-old girl with asthma wakes up in the middle of the night, when the 17-year-old girl who's being bullied at school is feeling suicidal on a Saturday evening, she comes to the emergency department.
The Credit Valley Hospital is functioning at 200% of what it was built for.
In 20 years from now, we will have 175% more seniors that need care, both in the hospital and at home. We'll have 50% more children who will require care.
Some of our current challenges with the physical space are that we can't segregate our children from our elderly population. It's not uncommon for us to have children next to elderly patients who are vomiting or maybe quite ill. We have challenges in treating patients with mental health and not having special rooms for them to be seen in.
In addition to building out more space, we need to create specialized spaces for our children, for our seniors, and for our mental health population. 90% of our mental health admissions arrive through our emergency department at Trillium Health Partners. And we've seen a significant growth in the number of pediatric admissions, over 30% more this year over last year. An important and exciting new initiative will be the development of an adolescent mental health urgent care program.
What we can do with your support is continue to build the structure, but really change the way that we provide care so that we can improve quality and experience and continue to be leaders in system change.
We all know those working in healthcare are facing challenges each and every day delivering it. And we know our patients deserve the best.
Now imagine a space where these patients can go, one that provides them safety, solitude, and specialized care in a time of their greatest need.
Trillium Health Partners is in a unique situation to lead not only at a system level in the province, but also nationally and internationally in new models of care. And with your support, I believe we can do something incredibly special.
Imagine improved facilities that provide quality care amongst the best in the province.
Imagine those tools in the hands of most talented, and skilled experts in emergency medicine anywhere in the country.
Imagine going home from the hospital faster.
Imagine
being able to change the things that really matter.
Imagine being able to deliver the right care in the right place at the right time.
Imagine a new kind of healthcare for a healthier community.
Imagine
what we can do together.
What a great, inspiring video. So, Dr. Letovsky, tell us, we just heard in that video our community is growing so quickly. So what does that mean for the emergency departments?
Well, Patty, as the community grows, there's going to be an increased demand for our ability to provide urgent and emergent care to people who live near the hospital. And we have a responsibility to get our emergency care down pat, because when you need it fast. And we have a responsibility to our city to be able to provide not only the best doctors and nurses, but also the best facilities and the best equipment so that we can provide the highest quality emergency care in the country, bar none, to this city of Mississauga.
Now, when I looked at that video, it looked to me like there were some areas that were congested, because I think that's actual footage of our emergency departments.
Correct.
Is that correct?
Correct, very congested. At the Credit Valley site of Trillium Health Partners, we're currently seeing 100,000 patients per year in a facility built for 50,000. So we are too congested, we're too crowded, and that's why we're so excited about the redevelopment, the renovation, and the expansion of the emergency department at that site.
Yeah, I'm pretty excited about it as well. So when does that redevelopment actually start?
So it's going to start in the new year. 2015 is the kickoff.
Right around the corner.
Correct. It's starting soon, and we're so excited. And one of the reasons we're so excited, as demonstrated in the video, is that we're going to be able to pay particular attention to our most vulnerable patients, the elderly, the children, and patients with mental health. And what we're going to be able to do that we weren't able to do in the previous structure is to provide specialized compartmentalized areas to deliver specialized care to those patient populations. So we'll have a kid-friendly zone. We'll have a zone that's friendly to our mental health populations. And we're going to redesign the whole emergency department to be seniors-friendly, wide hallways, oversized washrooms, clocks that have large numbers. So we're very excited about our ability to provide better care to our most vulnerable patients.
So it sounds like you're growing not only specialized areas, but you must be taking up more square footage.
Correct. We're adding square footage, so we're expanding and renovating at the same time.
How exciting.
Very exciting.
And when was the last time you were able to do any kind of change to the emergency department layout?
The last time we renovated was 1996, 1997, so it's been almost 20 years. It's been close to 20 years, so it's due.
This is a very precious time for the emergency department.
It is.
And so maybe I can ask Meaghan, you know, the role of the foundation in enabling something like this to happen. What does that mean, and why is community support so important in initiatives like this?
Patty, we are so privileged at the foundation to work with people from across the community, from outside the community, who recognize we're building something together. And the emergency department is a great example of how the community has rallied together support with this. Funds have been raised through foundation events like golf tournaments and our Laugh Out Loud Gala last year. Third-party events such as the lemonade stand and walks have been run.
We heard about the lemonade stand. That's amazing.
All of those types of events can contribute to projects just like this. Every single dollar goes to important projects like this. So there's a great role for anyone in the community, either through volunteering at these events on our committees, setting up a personal fundraising page, or coming to one of our events. Everyone has a role to play, and it's just wonderful that we can build this together in our community.
And so I know that there's some future plans at the Credit Valley Hospital site on our emergency departments, but I think the foundation also supported something happening at our Mississauga site most recently. So can you talk a little bit about what those changes were?
Correct. At the Mississauga site of Trillium Health Partners, we developed a mental health zone with 6 designated rooms, specialized rooms, a much quieter environment, an environment much more conducive to providing good quality care. And it's been so exciting to have that, and we're getting tremendous positive feedback from patients who've needed that specialized care zone.
And I think that was mostly all enabled through the foundation. Is that correct, Meaghan?
Absolutely, and it was funded through individual donors who made large pledges and also smaller events.
Talk about an amazing partnership.
Yes.
Absolutely.
So Meaghan, what are your favorite fundraising events? I know that the foundation, your president and CEO, Steve Hoscheit, talked about I don't know how many thousands of events that are held each year, but what are some of the more, the bigger ones or the more memorable ones that you host?
Well, as Steve said, and as you mentioned, we have almost 200 community events that are done out in the community, plus all the personal fundraising pages. And then our foundation hosts events as well, where funds are directed to different initiatives. So we have 3 golf tournaments done each year. We have a Diwali Gala that was just in October, where we raised $850,000 for cancer care at Trillium Health Partners. And then coming up in the new year, we also have our Laugh Out Loud Gala, which will be benefiting mental health and funding some of the projects that Dr. Geist spoke about earlier. And then we also have a bed race that's run in Celebration Square, downtown Mississauga, in the summer, and then our Scotiabank Skates, which will be raising money for diagnostic imaging and will take place at the end of January. So those are some of our foundation events, but every event I would say is one of my favorites because we're all coming together to raise money for the hospital.
Well, it sounds like the foundation is doing such meaningful work for, I know, our staff, our physicians, and our patients as well. But it sounds like you also have a lot of fun while you're working.
We do. I mean, we're so inspired to be working with such great partners in the hospital. It's our job to inspire support from the community, and so invariably we have to be inspired by the work that we're doing. And it's so exciting because I think health is so important. I know that that if you don't have your health, it's hard to be as happy and be inspired. And so we have the great pleasure of being able to work with people in the community who feel that way, and recognize that as a community we're building this hospital together. It's built by the community for the community.
So it really is a true partnership, I would say, between the hospital, the Trillium Health Partners Hospital, as well as our Trillium Health Partner Foundation. And thank you both for sharing the important work that you do and the future vision of the emergency department and beyond that with the foundation. I just want to say thanks to all of our guests who joined us today as we learn more around the importance of the Trillium Health Partner Foundation and the work that we do. If any of you need more information around the work that we do, please visit us on www.trilliumhealthpartners.ca. And it's clear that when we work together, we're actually better together. And so thank you for joining us today as we share with you some of the ways we're working towards creating a new kind of healthcare for a healthier community. Thank you for joining us.